Hello, dear friends. I'm sure you saw this case on the Insta, and there are many people who messaged me to ask a few questions about this case. This case actually came to me a few months back, and the history was very simple that she got RCT done a few years back, and then she developed a sinus opening for which the earlier dentist did some curettage and some periodontal therapy, and then the sinus opening had reduced for few days, but then again it came back. So on visiting to my clinic, I saw the X-ray, and this is a very huge lesion. And generally, this much huge lesion generally falls in a category of cyst, and the prognosis is generally considered to be very poor because the healing is very unpredictable. So the main issue here was there was a continuous sinus opening, and the patient was very young. So in young patients, we can have a good healing sometimes. So I thought that there is nothing wrong in trying to save this tooth rather than planning for extraction, because the patient was also very keen on saving this tooth, and me being an endodontist, it is my always it was my priority to always give a try if patient wants to save it. So what we did here is that I removed the distal GP, and I kept the mesial GP, although I know it is short. So I have not opened the mesial canals yet because I saw that the lesion is in the distal root. So initially, after removing the GP, I had put the water-based calcium hydroxide, which generally has an action till 10 to 14 days, and I called the patient two times in a month. Unfortunately, the sinus was not healing, and I felt maybe this case will go for a long term follow up. So I decided to give a oil based calcium hydroxide in the distal root, and surprisingly, after 1.5 month to 2 month, the sinus opening has disappeared, and the radiolucency of this lesion has definitely reduced. Now you may ask me that is it right to leave this tooth with just calcium hydroxide? You can leave the tooth with calcium hydroxide, especially if it is a oil-based calcium hydroxide. You can leave it for almost 1 month, and but you have to make sure that you have to give a temporary crown so that the supraeruption doesn't happen, and in future you may have done a nice RCT and healed this lesion, but if there is a supraeruption, then there is always another different problem with it. Before starting this case, I definitely advise the CBCT to rule out if there is any different etiology, but fortunately this was more of a large abscess or a cyst kind of a lesion, and the healing is definitely good. Now there are few people who have asked me that why I have not obturated this case with a bioceramic sealer or any sealer now. Now one should always remember that there are various ways in which you can do endodontic treatment. There is no fixed way of doing a treatment, and that is why in post graduation you should try different ways of treating different cases, and after that over a period of time you will have your own experience, and based on that you will start doing the treatment. So this large lesion, although I felt it was healing in 1.5 month to 2 month, but I wanted to be very sure that the radiolucency is clearly reduced, and maybe then I will start obturating the canal. So I have decided to wait for another 1 month, and maybe then I will obturate the distal root and retreat the mesial root, and then I will still give a temporary comb for few days, and then after that I will shift to the permanent. Of course, I know this is going to take a lot of time, but cases like this we generally go for surgical treating them non-surgically always takes time, and one should not hurry to obturate cases, because once you obturate, then again removing, again putting calcium hydroxide is very difficult. So rather than giving a temporary crown, putting calcium hydroxide, maybe oil based one, in very few cases where you want to keep it for long duration, really helps. So if you have any further questions, you can mention in the comment section and I will definitely answer it. Bye.